Welcome. Thank you for joining us today. My name is Janice Butchko, Senior Project Manager for the MDS Foundation. Also joining me is my colleague, Ashley Moncrief, Director of Patient Care. We will be moderating today's webinar. Thank you to our sponsors for supporting this webinar program: AbbVie, Bristol Myers Squibb, Servier, and Taiho Oncology. Please note, this is a pre-recorded presentation, so the presenter will not be taking any questions. The live questions with answer segment for all participants are included at the end of this presentation. Joining us today from the National Alliance for Caregiving is Toni Gingerelli, Director of Policy and Advocacy, and Yadira Montoya, Programs Director. The National Alliance for Caregiving was established in 1996. It is a national membership coalition that brings together more than 50 national healthcare companies and nonprofits, care innovators, caregiving advocacy organizations, and financial service leaders to advance a common agenda of building health, wealth, and equity for America's 53 million family caregivers. It is my pleasure to introduce Toni and Yadira.
It's a pleasure to be speaking with you today. The National Alliance for Caregiving is a membership-based organization catalyzing systems change to make family caregiving more dignified, equitable, and sustainable in the U.S. Our mission is to make the lives of family caregivers better through policy and advocacy, research, and programmatic initiatives. During my presentation, I will be sharing some of NAC's research and highlighting our programmatic efforts in transplant care. We are a nation of caregivers. There are 53 million individuals providing unpaid care to individuals, to an adult or child with a chronic health condition, disability, or functional limitation. 60% of these caregivers are caring for an older adult. Most are taking care of a relative, often a parent-in-law, followed by a spouse or a partner. And we also know that about 10% of these caregivers care for a friend, neighbor, or someone that they are not related to. When caregivers are asked to identify their care recipient's main health problem, the three most common problems or illnesses cited include old age, mobility issues, and Alzheimer's disease or another type of dementia. Like in other aspects in our society, we see significant gender, racial and ethnic, socioeconomic, and geographic inequalities in the caregiving experiences and needs. On average, caregivers spend 24 hours per week providing care and support. These activities are quite long and diverse. First, let's look at the activities of daily living. The ADLs refer to basic self-care tasks and everyday skills. We found that 6 in 10 caregivers are helping their care recipients with at least one ADL. The most common activity is helping the person getting in and out of their bed or their chair. Caregivers caring for someone with memory problems perform more ADLs and report that helping with these tasks is more difficult. Caregivers also help with instrumental activities of daily living, IADLs, which are tasks that require more complex thinking and organizational skills, which are also listed on the graph. On average, caregivers help their recipients with 4 IADLs, with almost all caregivers performing 2 or more of these tasks. In addition to these time-consuming activities, we also see that more and more caregivers are managing and performing nursing tasks if the person that they care for has a complex medical need, such as cancer. These tasks include administering injections, tube feedings, catheters, and colostomy care. Usually caregivers are taking on these responsibilities with little or inconsistent education or training from our healthcare system. Other key tasks caregivers are performing include monitoring their care recipient's condition, communicating with and advocating on behalf of their care recipient with healthcare providers and other social service and aging providers. The main takeaway from these three previous slides is that the demands of caregiving is increasing. Our research measures the intensity of caregiving, which we calculate based on the number of hours of care, the type, and the number of tasks that caregivers are performing. And in fact, about 40% of our caregivers report being in a high intensity situation. And we also know that African American and Latino caregivers are more often in high intensity care situation than their white or Asian American caregiver counterparts. Most caregivers are providing care and support out of a deep sense of love and commitment. However, providing this care often comes with significant cost. The next three slides speak to the health and financial impacts of caregiving. Caregiving is a demanding job. The stress of caring for a sick family member or a loved one can take a toll on the caregiver's health and well-being. Many caregivers don't have access to the support service systems that they need, which make providing this care even harder. 1 in 5 caregivers rate their health as fair or poor, which is a slight increase from 2015, and 7 out of 10 caregivers feel that providing care has not affected their own health. However, 1 in 4 feel that it has made their health worse. So if we focus on this 1/4, it represents 12 million caregivers who are reporting that caregiving has impacted their health in a negative way. Almost 40% of caregivers consider their caregiving situation to be highly stressful, while an additional 28% report moderate emotional stress. Caregivers who had no choice in providing care report a higher amount of emotional stress. We also see that about a half of caregivers experience at least one financial impact because of caregiving. We see that about a third report that they have stopped saving, about a quarter have taken on medical debt, and 1 in 5 report having trouble meeting their basic needs, such as paying for bills. Here we see that African American and Latino caregivers also report a higher number of financial impacts in comparison to their non-Latino white caregiver counterparts. Interestingly, our research also shows that caregivers with household incomes less than $50,000 show comparable financial impacts irrespective of their racial and ethnic background. For the last part of my presentation, I will focus on transplant care, which is a long and demanding process that relies heavily on family caregivers. Last fall, NAC released a report that explored the experiences and challenges of caregivers who provide care to someone waiting to receive an organ, stem cell, or bone marrow transplant, or someone who has already received the transplant. We conducted a literature review, spoke with the subject matter expert panel to understand pre- and post-transplant practices, including screening, resources, and supports. We conducted focus groups and spoke directly with 30 transplant caregivers to better understand their experiences. And these participants represented a diverse group across age, race, ethnicity, income, status, geographic location, sexual orientation, gender identity, stage of the transplant process, and relationship with the transplant recipient. And lastly, we spoke to 12 caregivers about their day-to-day experiences of being a transplant caregiver. And these oral histories were summarized in written vignettes that we included in our report. And we also have them available as short videos in our NAC YouTube channel. The report revealed that transplant caregivers face similar challenges as other family caregivers, but with the added complexity due to the intensive nature of the transplant process. Caregivers play a critical role across the entire transplant process. This includes evaluation, maintaining waitlist status, and providing pre- and post-surgery support. And this is due to the fact that transplant centers require verification of social support in order for someone to be waitlisted for most solid and non-solid organ transplants. This requirement means that to receive a life-saving procedure, transplant recipients must identify someone available to provide care and support for them around the clock. However, despite the critical role that family caregivers play in the transplant process, we have limited knowledge on the experiences and their needs. This knowledge gap is even bigger for transplant caregivers of racially and ethnically diverse backgrounds, as most of the research on this topic has been conducted on non-Latino white populations. Understandably, the current emphasis in transplant care is on the transplant recipient. However, this also means that the caregivers are offered what's available. And this broad approach isn't individualized or intentional, resulting in limited or declining support unless the patient speaks up on behalf of their caregiver or the patient misses an appointment because of an unmet caregiver need. Education and training on the transplant process, on its complications, infection risks, medication adherence, medical and nursing tasks are some of the areas that have direct and really important implications for transplant recipients' recovery and quality of life. This slide lists the major challenges reported by the caregivers in the focus groups. Caregivers of transplant recipients found the waiting list rules confusing and frustrating due to the variations and lack of information, making it hard to keep patients healthy and on track for transplants. Caregivers also shared that transplant care teams were most helpful earlier on in the process. However, there was a noticeable drop-off in support from the healthcare team post-transplant. Caregivers would often find that their medical team was smaller, with less resources available to them, and that they were receiving fewer medical updates. Like other caregivers, transplant caregivers' responsibilities included interacting with, communicating, and advocating with various healthcare professionals on behalf of their care recipients' behalf. They reported that medical logistics were a barrier to accessing care and a source of frustration. Caregivers of a family member with Medicaid insurance also reported that they perceived that the quality of care that they were receiving was lower, making it more difficult for them to provide the care that the recipient needed. Caregivers also reported the financial burden of the frequent medical appointments, travel cost, and the potential overnight stays near hospitals. Transplant caregivers reported challenges maintaining their employment and their impact on their income in terms of lost income or having to pull from their retirement or savings account to pay for the travel cost and the medical appointment. Caregivers also said that they found it difficult to receive both timely and relevant information, especially related to navigating what they call confusing and complicated transplant process. And finally, transplant caregivers reported experiencing a decline in their mental, financial, and physical health throughout the caregiving journey. Social relationships suffered as caregivers prioritized their care recipients' needs over their own. They reported that managing their emotions was difficult due to the constant stress and lack of systemic support, and also reported feeling isolated due to the unique challenges that they were facing, and that the relationship with their care recipient often became strained as a result of the changing roles and boundaries. These findings in the report point to a strong need to establish awareness of the gaps in support for transplant caregivers among health system leaders, policymakers, and the patient advocacy community. We developed the following recommendations to help ensure that caregivers of transplant patients are provided the necessary and deserved support, services, and resources throughout the transplant journey. These recommendations are aligned with the 5 goals of the 2022 National Strategy to Support Family Caregivers, which my colleague Toni will be talking more about in the second half of the presentation. The first recommendation is a standardized screening process and caregiver identification. The lack of standardized screening criteria necessary for a transplant leads to a lot of bias and opens the door for a lot of additional inequalities, especially for socioeconomically disadvantaged communities. A standardized process would delineate the necessary requirements that are applied across transplant centers. Additionally, caregiver identification during the screening process would help determine who is meeting the criteria as a caregiver, who is being turned away, and why. 2, caregiver-specific data sharing and coordination among transplant centers. Transplant centers should standardize their process for data sharing and coordination to ease the complexities caregivers face when coordinating care. Coordinated, efficient, and simple mechanisms of sharing or updating information internally across transplant systems would save time and stress for both the caregiver and the transplant patient. It would also be especially beneficial for family caregivers who must enlist a family member who has been removed due to poor health. 3, a coordinator in the transplant team dedicated to the family caregiver. The transplant team services and supports are designed primarily for the transplant recipient. However, because the caregiver is integral to that transplant patient's health, they deserve to be supported as well. This can be done with a designated caregiver coordinator. 4, the implementation of a routine family caregiver screenings and delivery of support services to respond to those unmet needs at critical points along the transplant journey. Routine screenings the needs of those caregivers and connect them with the resources that they need when they need them. 5, our findings reveal that the economic impact of transplant caregivers and the financial burden of the transplantation process is incredibly burdensome. Implementing financial assistance for transplant caregivers and ensuring adequate medical coverage would allow them to care for the transplant recipients in a better, less stress situation. Strengthening state programs like Medicaid also play a critical role in alleviating transplant caregivers' financial burden without jeopardizing their current or future financial situation. So with that, I am going to turn it over to my colleague, Toni. Thank you. Here is my contact information, and I'm happy to answer any questions during the Q&A session or connect with you on our transplant care project.
Well, thank you so much to my colleague Yadira for talking a little bit about the programs that NAC works on and giving some highlights of our Caregiving in the U.S. report. So my name is Toni Gingerelli. I'm the Director of Policy and Advocacy at the National Alliance for Caregiving. And I'm going to switch gears a little bit to talk about a different lens of caring for the caregiver, in particular, policy and advocacy. So I'm going to start by giving a little bit of background, on the national strategy to support family caregivers, what that entails, how it was created, and then go into some more detail about our work with the Act on Raise campaign and opportunities to engage in advocacy and policy to further support family caregivers from both an economic security lens and also health and well-being. So I'm going to talk a little bit today about the national strategy to support family caregivers. So the national strategy represents the first time a broad cross-section of the federal government has collaborated with the private sector on a response to a longstanding national need for a comprehensive system of family caregiver support. So the national strategy, led by the Administration for Community Living, was developed jointly by the advisory councils created by the Raise Family Caregiving Act and the Supporting Grandparents Raising Grandchildren Act. So these were two pieces of legislation in Congress that created advisory councils, and these advisory councils created this national strategies to support family caregivers. And this strategy was created with extensive input from the public, including family caregivers themselves and the people they support. And the national strategy is, a product of a comprehensive analysis and input from the federally appointed advisory council, which I talked a little bit about before, but also 15 federal agencies and more than 150 organizations representing a range of stakeholders from across the nation. And again, it's really important because it represents the first time that private sector and federal government have come together, as well as nonprofit partners, to create a roadmap for supporting family caregivers. So the national strategy, again, includes 150 actions on the federal level, as well as 150 actions that can be taken at the state, local, and private level. And really the focus of it is, how do we build a national infrastructure that ensures that family caregivers have the resources they need to maintain their own health, well-being, and financial security while supporting others. So the national strategy is broken down into 5 different goals, and I'm going to talk a little bit more about what those outcomes under those goals look like. But the first is increasing awareness of family caregivers and their experiences, as well as outreach. The second is advancing partnership and engagement, and this is really about healthcare coordination. The third is strengthening services and supports. The fourth is ensuring financial and workplace security. And then the fifth is expanding data, research, and also evidence-based practices. So you can go to the Administration for Community Living website to learn a little bit more about the national strategy. It breaks down some of these federal actions as well as actions for the states to take, and dives into detail even more so than I'm going to talk about in this presentation. So breaking down the goals, so here are some examples of what outcomes would look like under each of these goals. So the first, increasing awareness of and outreach to family caregivers. So one example of an outcome would be that Americans are educated about and understand the experience of family caregivers. And an example of implementation would be establishing an awareness campaign and information platforms to reach caregivers. Another example could be family caregivers are embedded into federal, state, territorial, tribal, and local planning. And an implementation example could be creating conduits for caregiver inclusion between decision-making councils and communities. For goal 2, advancing partnerships and engagement with family caregivers. And again, this is something I wanted to emphasize, that it really is about healthcare coordination. I think the title of that could be a little misleading, but you'll see in some of these examples, for example, outcome 2.2, identifying services and support needs for caregivers by instituting a review of family caregiver strengths and preferences using evidence-based assessments. So it's a little bit of a mouthful, but a way to implement this would be the federal government, states, and healthcare systems and community-based organizations should make culturally competent caregiver assessments a standard part of care delivery where appropriate. Goal 3, strengthening services and support for family caregivers. Something that we hear time and time again is about respite services. So outcome 3.2 is family caregivers can obtain respite services that meet their unique needs. And an implementation example is, state and local government agencies, insurance payers, and managed care plans, as well as community-based organizations and faith-based organizations and other providers can consider expanding and prioritizing funding for payments that support respite services. Goal 4 is all about financial and workplace security for family caregivers. We know from the data, and I believe Yadira touched upon this a little bit as well, that 45% of family caregivers have had some type of financial impact as a result of their caregiving responsibilities. So making sure that they have that security is very important to the work that NAC does, as well as a lot of our partners. So a few examples of that would be increasing access to planning services, such as advanced planning and decision-making supports, which are crucial legal and financial tools for family caregivers. And then lastly is this piece of expanding data, research, and evidence-based, evidence-informed practices. Something that is very important to us at NAC is making sure that we have the data to support evidence-based policies. So we like to think of it in many ways as a form of data advocacy. So one example of an outcome that I thought was worth highlighting is, family caregiver research facilitates the development family caregiver research facilitates the development and delivery of programs and supports to enhance the health and well-being of family caregivers and the person receiving supports. So one implementation example could be states can support this by collecting more and disaggregated data on family caregivers, and community-based organizations can also collect and report on this data and share it with researchers to help inform these practices. So when we think about the national strategy and we think about the work that we do with systems change, and we really try to think of it from a public health lens. A lot of the work that we've done before, and this is just a report that I thought was worth sharing from 2022, was about chronic disease, family caregiving through a public health lens. And as we think about these supporting family caregivers, we really try to think about how do we change systems when it comes to economic security and health to better support them. And this comes in a variety of ways, shapes, and forms. To make sure that these actions are implemented, the National Alliance for Caregiving launched the Act on Raise campaign alongside 11 steering committee members, who I'm going to talk a little bit about later on. And our campaign goals are to accelerate the implementation of the national strategy to support family caregivers and strengthen federal level coordination needed to support America's 53 million family caregivers as envisioned by the RAISE Family Caregivers Act, which I talked a little bit before about prior. So this is our steering committee. We have a wide range of stakeholders across the caregiving continuum. You can see aging groups, patient advocacy groups, disability groups, and caregiving groups. And we've brought all of them together to help strengthen our nation's first ever national strategy. And our campaign is focused on 3 pillars and core strategies. So the first is mobilize and align. So that's mobilizing and aligning stakeholders across the caregiving continuum around priorities and advocacy opportunities to support the national strategy. So as I mentioned before, there are 350 federal actions within the national strategy. So coming together with our steering committee, we've created a prioritization process to be able to figure out which which actions are most important to focus on, what needs to be improved, what recommendations need to be made to the advisory council, things of that nature. The second is educating policy makers. So that's educating them about the actions outlined in the national strategy and opportunities for implementation. And then the third piece is raising awareness of the far-reaching impacts of caregivers on families and communities and the economy. A lot of this is also about changing the culture and the conversation that we're having around care and the important role that family caregivers play. So I'm here to talk to you a little bit more today about opportunities to get involved and engage with advocacy to support family caregivers. So one of the opportunities that we have through the Act on Raise campaign is to join us either as a campaign partner or as an individual advocate. Once you sign up to become a campaign partner or advocate, and you can do that at actonraise.org/join us, which you can see on the screen, you'll receive a newsletters with information sharing, communications content, turnkey advocacy opportunities, so sign-on letters, petitions, things of that nature. An example would be we recently, a few months ago, put together a public comments campaign focused on supporting caregiver training codes within the physician fee schedule. And this is really about creating a louder voice on implementation for the national strategy, but also for the 53 million family caregivers across the country. And one of the things that we like to emphasize for our campaign partners is we try to make these advocacy opportunities as easy as possible. We understand that family caregivers have a lot of responsibilities as is and have limited time. So we create templates that make things easy, from sending an email to your representative, to signing a petition, to sending in a public comment where we can, already create a template where you can just add a little piece of your own story to share with the agency that is creating the rule or regulation. So this really is a call to action to be able to share your voice and your experience as a caregiver for someone with MDS, and particularly being able to bring that voice to the conversation is really important. So we would love for you to be able to be a part of our campaign and share your voice. And the last piece of this I just wanted to mention for awareness sake is we also launched a state network a few weeks back. And this is, and before moving on to talk a little bit about our state network, I also wanted to mention that the Act on Raise campaign is funded by the John A. Hartford Foundation, who's been fundamental to a lot of the work that we've been doing surrounding caregiving, specifically focused on aging, but also for folks with chronic conditions and disabilities. So a little bit about our state networks. I talked before about these federal actions through the national strategy, but there's also opportunity for things to happen at the state level. So a few weeks ago, we launched the Caregiver Nation Network, which unites caregiving leaders across 10 states, and a shared mission to improve support for family caregivers. And the role of the National Alliance for Caregiving in this is fostering collaboration and providing essential tools, including policy and media training, data-driven insights from our Caregiving in the U.S. report, and enabling state partners to champion impactful change for caregivers nationwide. So we do this through cultivating state leaders for championing the needs of family caregivers in their states, as well as fostering peer-to-peer learning on caregiving policy issues, and elevating family caregiving issues on the state and national policy agendas. And we believe that by cultivating state leadership, we are building a movement that changes systems for the better to support family caregivers and those that they care for. And then in terms of the states that we're working with, they include New York, North Carolina, Michigan, Wisconsin, Illinois, Texas, Hawaii, Arizona, Utah, and California. But if you visit caregivernationnetwork.org, again, caregivernationnetwork.org. You can sign up to learn a little bit more about resources that are available at the state level as well. And in summary, before I close out, I really wanted to emphasize that there's an opportunity right now to advocate for family caregivers as the national agenda is changing around policy to really start to focus on care and understand the important role that it plays in society and within our economy. So we hope that you all have the you all take the opportunity to share your voice and your stories, because they are so important in changing our system, to make sure that family caregivers and those that all of you care for are supported in our health systems and within our economy. So just wanted to say thank you very much for listening to our presentation. We're really excited to answer any questions you may have and have a conversation. I provided my contact information on the screen, as well as my colleague Yadira's information. And we're happy to answer any questions and be here as a support system on the programs or policy side, or connect you to folks, even if if we can't answer your questions directly. So looking forward to continuing the conversation. And I'll pass it back.
Thank you so much. This is Ashley Moncrief, Director of Patient Care for the MDS Foundation. I'm going to be moderating the question and answer period. So the first question that we have is, can you give some example of legislation that's already been passed that the caregiver can take advantage of, or some that are pending that maybe would be good for them to sign on?
Yeah, absolutely. I'm happy to take that. So the first piece of this is the RAISE Act. It's going to need a reauthorization process, which we're happy to provide some more communication on as that continues on. We're looking at different avenues to possibly reauthorize RAISE, possibly through the Older Americans Act, which is something that I would definitely say should be on everyone's radar right now on the Senate side, but also within the House soon to come. The Older Americans Act is going through the process of being assessed for reauthorization. And the Older Americans Act is fundamental to a lot of different caregiving programs throughout the country. So sharing your voice with your congressional representatives about the importance of funding the Older Americans Act, I would say, is really, really important. I'm also happy to share as a resource after about some of the pending legislation that has already been introduced within Congress that, again, could be shared after the webinar. But a few things that come to mind off the top of my head is the Credit for Caring Act. So this is a piece of legislation that would provide a non-refundable tax credit of up to $5,000 for family caregivers who qualify, who are also still in the labor force, to be able to apply for this credit to receive additional support. And the reason why this legislation came about is because, as mentioned before, we know that family caregivers caregiving responsibilities sometimes have financial impacts. A study from AARP recently found that on average, family caregivers spend about $7,500 on out-of-pocket expenses for family caregiving. So the idea of this credit is to be able to provide some type of relief for family caregivers who are paying for those expenses. And I would say that some states have already started to pass credit for caring legislation or similar legislation within their state legislature. An example that I give is, Michigan, for example, has proposed that in their state budget. I believe Nebraska has recently passed some legislation on this. So that's one piece. That's one part of legislation. One piece of legislation that I would recommend following. And the reason why I also mentioned, the federal side of things, but also there's a lot happening at the state level to create change. So I would also be tracking what's happening there as well.
Okay, great. Is there any caregiving or patient advocacy training available?
I can start off, and then I think this might be related to some of some of the information that Toni presented regarding the caregiver training services. And so I'll explain it from the programmatic side, and Toni, please feel free to add in any additional information. There are a lot of resources for caregivers. Um, we at NAC have, for the transplant caregiving report, we have all of our results, findings, and reports. We also have guides on different groups, whether they're racial or ethnic groups, or different caregivers who are caring for different conditions: Alzheimer's, cancer, transplant care, rare diseases, etc. Where, well, instead of I'm just going to turn it over to you, Toni, so that you can talk about the caregiver training services that were recently that were passed this year that allow caregivers to receive training, but through their healthcare provider.
To unmute myself for a second there. Yeah, sure. So happy to talk a little bit about that. Um, so, uh, you know, for in particular to talk about the CTS code. So to give a little bit more background on that, because I know I mentioned it during the presentation. So the 2024 Medicare physician fee schedules introduced new billing codes for caregiver training services that allow eligible practitioners to bill Medicare for providing training and providing and education to caregivers. Of patients with chronic illness or disabilities. And the new provisions aim to enhance patient care by equipping caregivers with the knowledge and skills needed to support their loved ones and manage their conditions effectively. And this aligns again with the 2022 National Strategy to support family caregivers and the Biden-Harris administration's efforts to improve access to quality care and empower caregivers. So, Medicare may not apply to everybody that is on this call, but the reason I bring it up is, you see Medicaid often follow with these new rules, as well as private health insurance companies. One thing that we're looking at right now is, how often these codes are being utilized because they are newer. But I always like to think of it from the caregiver perspective is, knowing that these codes exist, talking to your healthcare provider about utilizing them because they may not be aware of them is a really important piece of being a self advocate. So it's something that was recently implemented, and there's been some proposals in the 2025 physician fee schedule to kind of expand what these codes can be utilized for. And they really are important, particularly for those who are caring for folks with complex medical needs. And the reason why they're also so important is because now that there are codes, healthcare providers can spend time working with caregivers to be able to train them on these different things. So that's a little bit more about kind of what those CTS codes mean. And, I mentioned a few different resources, but we have a policy brief on going into even more detail on this, which I'm happy to share with the MDS staff of the MDS Foundation to share with you all as well post-presentation.
Great. So our next question comes from North Carolina. So they're wanting to know, how close are we to beneficial changes being enacted in that location? What are the current blockers to implementing change?
Yeah, sure. So I can't speak for North Carolina specifically because I'm not on the ground there, but I can say this. We see that there's a lot happening in the caregiving space in North Carolina, and it's one of the reasons why, as we built out our Caregiver Nation network, we wanted to partner with them and provide them with additional tools in terms of media outreach and policy education, as well as additional technical support. There's amazing work going on the ground, particularly with the they have a caregiver coalition, including the North Carolina Serious Illness Coalition. and they're always looking for advocates to provide their voice. They're right now working on a variety of different policies at the state level, and I'd be happy to connect whoever asked this question. Feel free to shoot me an email, connect you with the leaders on the ground who are doing some of that work. I think a lot of the barriers that kind of come into place are, around caregiving is, and talking to elected officials is helping them understand why it's so important to be investing in caregivers. A lot of the work that family caregivers are doing is often invisible, right? But it plays such a fundamental role in our healthcare system and such a fundamental role in our economy and our society as a whole. So sharing stories is a big piece of what we do when we work. We're helping advocates share their stories. It's a big piece of what we do here at NAC, and are working with some of our state advocates to do when they talk to their state legislators, as well as their governors and other elected officials. So I'd be happy to connect you with some folks in North Carolina to talk a little bit more about what is happening at the state level. I would say, what often happens that I see at the federal level is conversations about funding. A lot of times people are supportive of these programs for family caregivers, but the question is always, how are we going to pay for it? So we're exploring a variety of different avenues to make sure that happens through existing funding, and as well as a few different other avenues. So yeah, happy to connect you with the North Carolina advocates.
Great, thank you. Wondering if the state of Pennsylvania is part or is considering to become part of the state's network.
So within the 10 states that we have, Pennsylvania is not one of them that we're working with directly. However, we launched this a few weeks ago. We're looking to expand and to grow. So if you go to caregivernationnetwork.org, there's a Join Us section where you can learn more and get a newsletter that allows you to receive different resources about what's happening at the state level, different webinars. So there's other opportunities to participate, even if you're not in those 10 states. I know there's a lot of exciting work happening on the ground in Pennsylvania. There's conversation or progress being made on a state paid leave program that would be very beneficial to family caregivers, as well as a variety of other policies. But would love to connect offline and see how we can partner with folks in Pennsylvania, but also encourage you to sign up for our Caregiver Nation Network newsletter to receive resources on engaging with your state.
And I dropped the links to all of the websites for you all so that you can see them.
Great. We also have a question for MDS specifically. With MDS, there are a lot of labs involved. Are there resources available to assist new patients and caregivers to understand those versus learning on the go? So I can jump in just a little bit with the foundation. So if you do want to call me as the director of patient care or send me an email, I'm happy to kind of walk through what all of those labs mean. We do have an MDS glossary as well that gives definitions for all of those labs, so you kind of understand what you're looking at. So we have a lot of written resources, and then we're happy to, it's not uncommon for me to spend 30 minutes or an hour on a phone call explaining exactly what those mean. So happy to do that. I don't know if you guys have something to add to that.
Yeah, I think that for our transplant work, as I mentioned, we do have some educational resources, but as a NAC, we don't do direct service for caregivers. However, part of our work in research and highlighting the experience of different caregivers and advocating that caregivers get the adequate training and support that they need is something that we are very, very passionate about. And so as part of the transplant work, we are advocating we are advocating for caregivers to get assessed, for caregivers to receive training, education, and support, because we know that you all, or those that are providing care are doing a lot of medical and nursing tasks, doing a lot of activities of daily living, instrumental activities of daily living. And in order to be equipped and prepared to do those, we need information and sometimes training if it's a more complicated task, and of course resources and support such as respite care, etc.
Yeah, a quick question. So you touched on respite care. For those who are not familiar with what that is, can you talk a bit about what respite care is? If there's ways to find it, kind of give a definition.
Sure. So very broadly for respite care, for caregiving in the US, we ask caregivers around what type of help do they need, what they want, and it is tangible help like education and information. It is also respite care. So the idea is that a service or a program in which they can rely on someone to either come into their home and provide care and care for the person that they're caring for, so that the caregiver takes a break. Now, the way that how respite care is funded and the availability of it is something completely different. But in the sense, respite care is rest for the caregiver, whether that is provided by family and support or by like a formal structure, like an aging service or agency. And I keep punting it over to you, Toni, but respite care is one of the services that are under the Older Americans Act. And so that is another area where where NAC is actively working on and saying we need to fund programs that provide this type of support.
Absolutely. And beyond the Older Americans Act, I also wanted to highlight that there's the Lifespan Respite Care Reauthorization Act of 2024. Actually pulled up the bill number as well in case anyone's interested. It's S4325. And the act proposes amendments to the Public Health Service Act to extend and expand the lifespan respite care program through the fiscal years of 2025 to 2029. And the extension and expansion of this program directly benefits family caregivers by providing the necessary respite services, but also in the bill in the Senate updates the definition of family caregiver to ensure that more individuals can access support, reflecting the diverse caregiving landscape. And in particular, the expansion of the Senate version of this bill is focused on including youth caregivers who are often invisible but very much present in performing caregiving responsibilities and deserve access to respite care as well.
Great. Do you have any active listening boards that you're recruiting for right now? I know you mentioned listening boards and getting caregiver perspective. Are there any that are ongoing?
So I can take this on. It's not, we have an ongoing project that we called Portraits of Caregiving. And I want to mention it because the goal of the project is to really elevate the unique journeys of different caregivers across the lifespan and across different indications. And it is a story collecting project. And then we use those stories to highlight different policies and to highlight the need for different initiatives. And so I would encourage you to check out our website and submit a story, whether it's written or you can send us a short video. In addition to that, on the programmatic side, when we launch different projects, we do work often with advisory committees where we are working with caregivers, clinicians, and researchers to advise us and help shape the work that we're doing, whether it's research. So for the transplant report that I mentioned in project, we worked with an advisory committee that really helped shape that project to make sure that the research is grounded in caregivers' experiences, and that the recommendations are also really center their experiences. So that's how we are able to make change and ensure that the change that we're advocating for is really going to lead to concrete support and education and training and just overall an improved life and quality of lives of the caregivers that we are advocating for. So a little bit of the two answers to the question. One, please check out our Caregiving in the US, Portraits of Caregiving project and website, and consider submitting a story. And then also signing up for our newsletter and learning about our projects, because we actively look for folks who are interested in serving in an advisory board for those projects.
Great. I think some didn't, me personally, coming from the MDS Foundation in a clinical role, did not know that there's already legislation out there to help with caregiving. So if anyone's interested to see what's already been passed, is there a way to, like, a listing of that so they can find out what's available?
Yeah, I mean, so we don't have a full list of legislation that's already been passed. We've talked a little bit about some of like the programs that already exist, but there's been a few pieces of legislation that have recently been passed. I think it's more so helpful to focus kind of on the program side of things. That can vary state to state, but also within agencies. So happy to, again, after this call, provide a little bit of more background on some of the programs that do exist. But I guess, something that I think is worthwhile is talking maybe a little bit about legislation that's in the pipeline. That's kind of where my focus comes in, and, where we really need advocates' voices. Would that be helpful, Ashley?
Yes, I think just to figure out what they can do and how to be involved. We did get another question really quickly. So my husband has been a caregiver for 2.5 years through a bone marrow transplant and after effects, and we found that mental health was one of the biggest issues experienced behind financial and job impact. Are there any changes being supported in that area, in mental health specifically?
That is a great question. That takes us back to what we were talking about, the CTS codes. And so as Toni explained in 2024, the Medicare physician fee schedule included a pathway for reimbursements for providers to deliver caregiver training services. And that was a big win, first time ever. However, there were some limitations because it was the first time. And so we have been at NAC working and be monitoring the new physician fee schedule for 2025. It's issued every year. And we're really excited because part of the proposed rule includes behavioral health services. And please chime in with the exact terminology or like the technicality around that, Toni, but that would mean it is support service. It is behavioral support services for the caregiver. Again, those services are delivered from the healthcare provider side and the health system side. A lot of the conversations that we're hearing is we're already doing this work. And so what the codes do is provide an incentive and provide a reimbursement pathway for those providers to do that work, or for those health systems to include caregiver training services within their workflows. So we're very excited about that. Right now, it's a proposed rule. It'll go through a comment period, and then we're hoping that it is an addition to what we currently have in terms of the CTS codes, the caregiving training services codes.
Yeah, Yadira, I think you covered most of it. The physician fee schedule for 2025, the proposed rules just recently came out. So we're diving actually this past week. So we're diving deeper into them and hoping to, or gaining more insight on, what the impact is on family caregivers. But what I will say is, the mental health component of this, the caregiver training services, is something that is very important to us at NAC, and that we will likely be providing comments on. And what we do as well is we provide templates after going through the physician fee schedule. A little bit of a tongue twister there. We provide a template, and we did this for the 2024 rule, and we're going to do this for 2025, where anyone who signed up for the Act on Raise campaign, as well as you can visit our website, will receive a template that they can essentially download and add a little bit about their story and why these new codes and why these new rules and why mental health is so important to them as a caregiver, and also so important to the person that they're caring for, and then provide exact directions about how you can submit these public comments. And again, the purpose of this is to make it as easy as possible. Sometimes it can be a little bit confusing navigating the public comments process, and we're there to kind of guide you throughout it and provide you with a template to do so, hitting on like the key pieces that impact family caregivers.
Great. I also noticed your website has a lot of resources listed. Can you speak to kind of what those are, what kind of resources you have that, like a third party, I guess, outside resources that you can direct people to from your website?
Sure, I can take that on. I was sending the link because last year NAG published a brief on the mental health of caregivers that has some policy recommendations and also provides background and context on this issue. And so I think that's relevant to our earlier or previous conversation. In terms of the resources that we have listed in the NAC website, we have a lot of publications, again, around different caregiving communities, whether it's like racial and ethnic groups, rural caregivers, boomer caregivers. And then we also have publications and reports of research that we've conducted or we've partnered with others to conduct around specific specific health conditions. Again, cancer, Alzheimer's, transplant care, rare disease. There's a lot there. I'm sure I'm blanking on several of those topics. And then we also have a tab with resources for caregivers. We don't have a lot of direct services and a lot of publications that are direct support and resources for caregivers, but we do have a handful. And so one of them is called Take Care Community that lists different resources and supports for caregivers. I think that's the one that I want to highlight, and I'll drop it in the chat and it can be shared with the webinar attendees. But you're right, Ashley, there's a lot of resources. I won't name them all. It'll be a laundry list.
No worries. Just wanted to let them know it's available, and they can probably find some resources through that. So also, can you touch on some of the federal legislative priorities right now that are going through?
Yeah, absolutely. So touching upon like NAC's priorities, I think it's key to first start with like what are our four overall goals or priorities. And the first is championing caregiver health and wellness, so addressing the complex and often interrelated physical, social support and mental health needs of family caregivers. The second is driving economic inclusion, so ensuring financial and workplace security throughout the lives of family caregivers. The third piece is fostering caregiver friendly communities, so strengthening home and community-based services and public health supports for family caregivers. And then the fourth piece is building caregiver equity and inclusion. So addressing the systemic inequities that family caregivers experience across their lifespan. So I mentioned, and I don't think I did it enough justice, so I'll kind of repeat this as well. So one of our priorities is reauthorizing the Older Americans Act, otherwise known as OAA. There has not been legislation introduced on this yet, but it's coming through the pipeline. A little bit more background on the OAA. So the OAA supports close to 12 million older adults and caregivers annually. So since 1965, the funds it funds states and local agencies to deliver critical services, including but not limited to nutrition, transportation, in-home supports, health promotion, and disease prevention, as well as caregiver supports. So for reauthorization, NAC and our Act on Race Steering Committee is urging lawmakers to double authorize funding levels for all programs, with a particular attention to those that support family caregivers. We're also asking legislators to ensure that the reauthorization extends authorities and funding for the Raise Family Caregivers Act, and the National Strategy to Support Family Caregivers, which I talked a little bit about in my presentation, to advance the cross-cutting and national efforts to improve family caregivers. And then the third piece of that is ensuring that OAA includes opportunities to expand and enhance data collection efforts about the needs of family caregivers and their care recipients to inform program improvement for the growing population. And again, making sure that everything is evidence-based is really important at NAC, and we need the data to be able to do that. So we have a brief on our Act on Raise website, that, as well as our NAC website, that goes into a little bit more detail about what the Older Americans Act is, the impact that it has on so many family caregivers and those they care for across the country. So you can dive a little bit deeper into that. But I wanted to give a little bit better of an overview of that piece of legislation kind of in the pipeline, but not yet introduced. So I also mentioned the Credit for Caring Act. I think it would be helpful to also mention, this legislation has already been introduced in the House and the Senate. And to give you a little bit more detail, it amends Internal Revenue Codes from 1986 to introduce a non-refundable tax credit for working family caregivers. So it offers offering 30% of their qualified expenses above $2,000 and up to a maximum of $5,000 in a tax credit. So the credit is designed to support caregivers of qualified recipients who have specific long-term care needs, with the caregiver needing an earned income of over $7,500. So for anyone who's interested in looking specifically at the legislation beyond this overview, the Senate bill number is S3702, and then the House number is HR 7165. So you can look that up and go into a little bit more detail if you wanted. And I also wanted to emphasize that this legislation is bipartisan. It's sponsored by both Republicans and Democrats. So that's one piece of legislation I wanted to highlight. Another is called the ABC Act. It's the Alleviating Barriers for Caregivers Act. And the bill numbers are S3109 and HR 8018. And the ABC Act directs a comprehensive review by the Centers for Medicare and Medicaid Services, otherwise known as CMS, and the Social Security Administration, SSA, to streamline processes for Medicare, Medicaid, CHIP, Social Security programs, specifically to benefit family caregivers. And this legislation represents a concerted effort to enhance the relationship between caregivers and administering agencies, ultimately aiming to provide more supportive and efficient systems for family caregivers. Something that I found, and I'm sure Yadira has found as well, is when we talk to family caregivers and we also talk to care recipients, it's very hard sometimes to navigate the process of receiving a lot of these services and benefits. So what this legislation would do is really assess what are some changes that can be made to make the process of reaching these services or receiving these services easier, more accessible, which has great benefits to caregivers. Another piece of legislation that I wanted to mention is a bill called PACHITA, and it is the Palliative Care and Hospice Education and Training Act. So for those who don't know what palliative care is, it's a specialized form of medical care for people living with serious illnesses. And this type of care is focused on providing relief from symptoms and stress, the stress of the illnesses, and it really takes a holistic approach in how we approach care. And the goal is to improve quality of life for both patients and the family. And the Act aims to enhance the palliative care workforce by amending the Public Health Service Act, focusing on improving education, research, and career opportunities in palliative and hospice care. And it allocates $15 million annually from 2024 to 2028 for these initiatives, with an additional $5 million annually for training programs and the dissemination of palliative care information to enhance awareness among patients, families, and healthcare professionals. And the Act also includes measures to expand and intensify NIH, the National Institute for Health's research in palliative care. And this is a piece of legislation that has been around for quite some time, has passed through the House twice, and there's movement on it. So I'm very hopeful on that end. There's a group called the Patient Quality of Life Coalition, PQLC, that is doing incredible work to make sure this piece of legislation moves, and would be happy to connect anyone who's interested in that, learning more about palliative care or how they can share their story about how palliative care impacted them or their loved one, to PQLC, because they do a Hill Day every year, and would love to engage with anyone who has a story to tell.
Great. You mentioned job protection earlier. Is that in reference to like FMLA, or are there other things out there in place to protect jobs? Or is that kind of what you were referring to?
Yeah, for the most part, I was referring to FMLA. I know there have been attempts, and I can't speak to specific legislation, but at the state level to put additional protections in place for family caregivers who are performing care responsibilities. I believe California has attempted some legislation on that, but that's more so that for the most part what we were talking about. But one thing that I did want to mention is we're working with as well employers. Right now in the pharmaceutical space, we have a work group, and a lot of some of the recommendations even within the national strategy are focused on the private sector and what private sector companies can do with creating employer-based resource groups for caregivers, as well as creating internal policies that protect family caregivers. So even if it's not on the legislative side, it can be done at the private sector end of things too, through internal changes. So that's some of the recommendations that are outlined in the strategy, but are also opportunities for folks to talk to their employers about how you can create systemic change within your organization. And I don't know, Yadira, if you have anything else you wanted to add on that.
Yeah, I want to add a little bit about the workforce. And so we do have a couple of projects that as part of the national strategy and are being led by the American Community Living, ACL, focused around ensuring that there is a workforce, the direct care workforce that is available, that's ready, that's trained, that has adequate supports to provide care to older adults or individuals with disabilities. That's a big piece of the conversation as we come out of the pandemic, and recognizing how much workforce workforce shortages are an issue within the healthcare system and within health allied services. And so I'll share the project. It's called the Direct Care Workforce Strategy Center, and it is more, the intended audiences are states who are really interested in investing in their workforce. The project includes a resource hub as well as opportunities for a peer learning network, and then to provide or to receive technical assistance from experts in the direct workforce space. I guess fortunately and unfortunately, those opportunities, they have already started and the states have been selected. But I think that's the Direct Care Worker Strategy Center is a really good resource for folks who are interested in learning more about some workforce issues within their states or are involved in these kind of topics and conversations. So that's what I'll add.
Yeah, I think for the last question, you also mentioned Hill Day. So is that something caregivers can get involved in? If so, can you explain a little bit about what Hill Day is for people that maybe don't know, and what their role could be?
Yeah, absolutely. So a Hill Day or an Advocacy Day is a day where advocates head to Capitol Hill here in Washington, D.C. Now, often states will do their own Hill Days. I know some of the states that we're working with through the Caregiver Nation Network already established days to talk to their state legislators, um, and they go to the Hill and they talk to their specific representatives about issues that are impacting them. It's usually a piece of legislation. Last year, we had the National Alliance for Caregiving and Act on Raise had their first ever Hill Day, where we engaged over 50 advocates who met with over 75 offices. So that's congressional representatives, so in the House and the Senate, to talk about the national strategy to support family caregivers and how the strategy impacts their lives and why it's so important that we are implementing the strategy and also funding the implementation of the strategy. The strategy. So there are opportunities to engage. We had our Hill Day last year, but now we're having our second Hill Day along with our Caregiver Nation Summit on November 21st. So on the 20th and 21st, our Caregiver Nation Summit will take place with the Hill Day on the 21st. So for anyone who's interested or in coming to the DC area or participating in the summit, we would love to have you. And what we do is for a Hill Day is, you send your information to us, and your address as well as a little bit of information about you, and we connect you with your representatives, right? We help set up the meetings and provide you with like a boot camp about how to tell your story and how to make an ask to a representative, because I know it can be a little intimidating at first, but we provide you with all the tools to be able to do so. And why is this so important? At the end of the day, representatives want to hear from the people that they represent, right? So they want to hear from their constituents. So when we set up those meetings, the advocates get to tell their stories and help representatives understand why it's so important that they are working on legislation and they are working to implement the national strategy to support family caregivers and the impact that it has for people in their district, right? And people in their state for the case of senators. So there are plenty of opportunities to get involved. If you can't come to the Hill Day, that's okay too. I would encourage everyone to reach out to their respective elected officials, and that can be on the federal level or the state level or even local. If there's a piece of legislation that interests you or there's an issue that's important to you, right? Maybe you don't necessarily have the legislation yet, but there's an issue that you're seeing within your community or seeing within from your family caregiving experience. And talk to them, right? That is the job of an elected official. They're there to listen to you. And at the end of the day, it means a lot more coming from you all than it does even from representatives here at NAC, because they want to hear from people that they represent. So as we're working on creating this Hill Day for this year, and would be happy to send that out to the MDS Foundation to share with you all. And find ways to engage. And if you can't be here, that's okay too. We are working on some opportunities to engage via social media kits and also reach out even via email and letters to respective representatives. So Hill Day is one of many ways to make your voice heard. And we hope to engage with many of you on that.
Thank you so much. Just from a non-policy caregiver resource, just to put a snippet in, please call us at the foundation if you need assistance or are looking for caregiver support. We do have a Center of Excellence network with over 200 centers, around 200 centers, excuse me, across the globe. We are happy to put in for mental health referrals for our caregivers. We do speak with our providers for resources for you guys as well. So feel free to reach out. Any closing remarks on your end?
I could start. So I shared a lot of links with you. I really encourage you to maybe bookmark them, sign up for our newsletter, sign up for the campaign newsletters to stay involved. There's so many opportunities, and it's a really exciting time to be working on issues of caregiving, because we and the movement feel like there's support and there's momentum and the conversation is happening, but we really need the help of everyone to say, like, my caregiving experience is this is my story, I'm willing to contribute it, or it is, I'm willing to sign on this letter, come to this Hill Day, or I'm looking for more resources, and so I'm gonna check out one of our briefs, whether it's the transplant caregiving report that I mentioned. There's a lot of great research there, the mental health brief, and as well as many of the publications that we have on NAC, on our NAC website.
Yeah, thanks so much, Yadira. And just to build off of that, I know we covered a lot in this presentation, and I know working in the policy world that sometimes things can seem a little bit overwhelming. But one thing that's really important to us at NAC is, how are we creating systems change, right? How are we looking at the structures to build the structures that exist to build a better care infrastructure for family caregivers across the country? And just to reemphasize what Yadira was saying, a big piece of this is storytelling, right? You may not be the policy experts, but we can work with you in helping you to tell your story, to be able to connect that to policy issues that are existing. And I would definitely say, another resource we have is, if you go to our the National Alliance for Caregiving website, there's also a story hub where you can see stories of caregivers from across the country and also sort through them by a variety of different categories and hear others' caregiving stories, and also a bit about how that connects to some of the systems change that's happening. And I think right now we're in a time where people are realizing, and particularly I think COVID shed a lot of light on this, about the important role that caregivers play in our society, in our economy, and just our healthcare system as a whole. And I think we're on the brink of change. So more now than ever, it's really important that caregivers' voices and care recipients' voices are at the table. And NAC is hoping to be a part of making sure that those voices are there, and look forward to connecting with you all to help make that happen. So just wanted to say thank you again for the opportunity to speak with you all, and looking forward to continuing to engage.
Thank you so much. A big thank you to Yadira and Toni from the National Alliance for Caregiving. Please check out their website and check out ours for the MDS Foundation. If you have any questions, feel free to reach out. We would like to thank our sponsors one more time. So that's Avi, Bristol Myers Squibb, Servier, Tahoe, and to VJ Hemong for helping us make this all possible. Have a great day.